The David Pakman Show at davidpakman.com.
Welcome to the bonus show. We've been talked on the Friday show about birtherism 2.0, which is, of course, the idea that's being floated that maybe Kamala Harris, and when I say maybe, I don't believe this, but the idea being floated is to question whether Kamala Harris is actually eligible to be vice president and president of the United States. And with the DNC starting tonight, Kamala Harris, of course, going to be speaking, Joe Biden, the formal nomination process, the entire thing over the next 4 days. This is something that the Trump campaign is not denouncing. When Trump was asked about it, he said, I don't know anything about it, but the guy who wrote the article is very well respected. Well, it turns out that the article was written by John Eastman, who's a right-wing attorney involved with a pro-Trump think tank. But the real question is, why did Newsweek publish this? And this is the first question I had last week. And Newsweek has now put out a statement apologizing for publishing the article, but they've not taken the article down. And it seems, I mean, listen, I don't know what happened behind the scenes at Newsweek, Pat. It could have been a calculation where they thought, we're going to get hit for this, but let's do it anyway, and then we'll apologize. Like, they might just be doing everything according to plan. Or maybe someone really stupidly didn't realize that this was going to be seen as racially tinged, obviously, because it seems it's only the non-white candidates that Republicans ever question, the eligibility of. I don't know what Newsweek was thinking. If you apologize but leave the article up, it's also pretty stupid. I mean, it's just a complete and total mess.
I'm wondering the exact same thing. Why would Newsweek publish this to begin with? Because they must have known it was going to be a big headline. They probably also knew that Trump would want to run with this because anytime there's a birtherism story, Trump's going to talk about it and the surrogates are going to talk about it. So it's very predictable. And the fact that now they're apologizing for it and not taking the article down, I don't know if they need to take it down because that almost looks like they're trying to cover it up. Like maybe if they take it down now, it'll be seen by the right as there being an actual case against Kamala's eligibility to become vice president and president. And so therefore, maybe it's best to just keep it up and make it seem like it's not some sort of cover up that they're trying to do at this point.
The other thing is that the way it's happened allows Donald Trump to continually say, I don't really know much about it, but, people are looking into it. And, I would have imagined Joe Biden would have vetted her and all of this stuff. And it keeps Trump at the part that seems very planned is if you wanted to insert this into the narrative, get it in front of Trump, but not put Trump in a position to have to say anything. You do it this way, where it keeps coming up when Trump does press briefings and Trump never has to denounce it. He just says, I don't know much about it. The guy who wrote it is trustworthy. You've got to vet candidates. I'm not really sure. And it just perpetuates it more and more and more. And it's like, how can you be either so stupid not to realize it would happen, or again, as you're saying, realizing it and maybe not caring?
Yeah, and Trump at those press conferences, what he's doing there is communicating to his followers that he does believe the birtherism theory, or he at least suggests that other people should buy it. But by the way that he's able to not, vet it himself or not support it entirely with his words at the press conference, that allows him to have a little bit of distance. So if it comes out that this was totally bogus, well, he never directly approved of it. He just said that it was something to think about. So that's why.
And of course, it is completely bogus, as we know. But yeah, you're absolutely right. And then at some point, somebody could say that he's actually responded in a smart way, in case someone at some point says, "Well, we've been asking you about this for weeks. How do you still not know?" He can just continue to repeat, I'm not bothered by this. I'm just running my campaign. It's for other people to look into. And he can just insist. The reason he hasn't looked into it is he's just not worried about it, which, of course, doesn't take it out of the conversation.
It's so pathetic to be a Trump supporter at this point because, Democrats right now, we're talking about coronavirus. We're talking about the economy and stimulus and direct payments. We're talking about Black Lives Matter, all of these important issues, universal health care. Trump is talking about defunding the post office. He's talking about whether Kamala Harris is eligible for becoming president of the United States. Did I say it right? I think I said it right that time.
You said Kamala.
I have a sticky note here to try to help me get it right. I really am trying to work on this here. See if you can see that. I have the comma and the la.
Beautiful.
So I think at some point over the next few weeks I'll get it right. But I really am trying here.
Okay, let's let's go away from Pat, who's very, very flustered over there. The birtherism 2.0, it's here. It's going to be around for at least a couple more weeks, and I would expect Donald Trump to continue to be asked about it. One of the during the coronavirus, one of the topics that has come up, and the administration has used it to justify opening, but also doctors have been discussing it as well, is the concern about late or lack of or later diagnosis of conditions, which will lead to later treatment of conditions, which we know in general you do better when you are diagnosed and treated earlier. And if people, for example, are avoiding going into their PCP because of a symptom which could be the first sign of cancer, if they wait 6 or 12 months because of the pandemic, by the time they go in, the cancer may be more advanced. Much along the same lines, it's not just diagnosis, but there's also screenings that are being delayed. So, for example, it could be as simple as a dentist cleaning. And as we know, oral health relates to general health, and, cleanings are important and so on and so forth. But dentistry, they're basically in your mouth, certainly not what you would immediately want to do when there's a raging pandemic. So that's a question. Then there's other screenings, colonoscopies, mammograms, etc. And so the big question is, should you risk catching coronavirus to get routine health screenings or preventive care? And the answer is, it depends. And unfortunately, there's really no simpler explanation. It really depends on the particulars of the screening and the condition that we are talking about. Putting aside for a moment that certain screening can increase your risk of cancer because of X-rays and other radiation. We're putting that aside a little bit. We're sort of talking about the benefit of screenings. And I know there will be people who say, hey, every time you get an X-ray, every time you get a mammogram, whatever, you're actually increasing your risk. Okay, well, we're putting that aside for a moment. A lot of it has to do with how much does the risk of death go up if you delay finding a certain condition for 6 months or a year. In other words, if you think about colonoscopies, for people who are 50 plus or at risk, if they delay a colonoscopy for 1 year, given the speed of growth of polyps and other things that would be investigated, what is the additional risk versus the risk of catching coronavirus by going in? And you would have to, it's actually not trivial math, right? Another example would be a mammogram, for example, or prostate, whatever we can think about it. And unfortunately, Pat, there's really no answer. And the other part of it that makes it difficult is you also can't really quantify the risk of catching coronavirus, right? If you're 51 and you're in a state where there aren't that many cases and specialists are spreading out patients, and even if you got coronavirus, you would probably be fine. How do you balance that with the risk of delaying a colonoscopy for a year? I mean, mathematically, it is very difficult.
Well, it's also really hard to assess the risk if you don't know what the ailment is in the first place. That's why you need the screening, right? If you don't know. But
that's a little different. So that might apply more to, I have a vague symptom. Normally, I'd go get it checked out, and maybe my doctor says, oh, that could be X, let's do a test. That versus routine screenings where you sort of know what you're screening for. But yeah, the same math applies.
Yeah, the same math applies. And I would like to say, you should be able to trust going into a doctor's office if you have the right precautions, right? Like if you're wearing a mask, maybe if you even want to go the extra step and wear the eye shield and the gloves and all of that stuff. But are people willing to give that advice to someone who's maybe in their 60s and 70s and more at risk?
Sure.
I mean, that's a tough calculation to make. I mean, it seems as if we're going out in public for many other things, like to get groceries or whatever, to do the bare essentials in life. So maybe seeing a doctor is one of those things that you can justify in your head. But if you end up getting coronavirus, there are going to be cases where that happens, and maybe you didn't need the screening, but you get the virus, and there's these long-term health implications. And when you scale it up to a country as big as ours, some people are going to benefit from not getting the screenings, and some people are going to be hurt by not getting those screenings. So it's just hard to say in every case.
The other thing is, you say you didn't really need the screening. You only know that after you've had it,
exactly.
Right? And so that's a complexity. My brother, who's out in California, has had both dentist and dermatology visits during all of this, and he said they were taking a lot of precautions where they call you and tell you when to come in. The back door is open. So instead of going through the waiting area and through a whole process, you go in a back door directly into an exam room, immediately sanitized, blah, 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 so on and so forth, and then directly out. And that he felt, even though obviously he would prefer not to be there, that the reason he was there sort of outweighed the risk he perceived based on how responsibly they were handling it. With all of these things, it's a very difficult thing.
Yeah, and if you have this like acute ailment that you have to get worked on,
of course,
then it's obvious that you want to do that soon. But then if you talk about like a dental cleaning, you're supposed to get those every 6 months. We've been dealing for the virus for about 6 months. Like I'm due for a cleaning, but I think it's the World Health Organization that's advising against people doing that right now.
Oh, are they?
At a certain point, though, if we're dealing with this for like a year or 2 years, they're going to have to reverse that. They're going to have to say like, okay, actually now we calculate that you have to get those cleanings because that's like a regular part of, updating your health and keeping up with it. So like at what point do they have to change their minds on that? There has to be some sort of day where that happens, right?
So I actually have a dental cleaning scheduled for September. It hasn't been delayed. It was just, I scheduled it 6 months ago. I had my last one in early March, right before everything got going. I mean, just days before the travel ban, I had my last one. So I'm due in September. We're actually going to be on vacation, which we'll be talking more about during that week. So I'm going to be rescheduling it. But my plan was to reschedule it into October. I wasn't planning on rescheduling for some future time. I guess I should do a little more research into dental cleanings at this point, like maybe going 9 months. But the thing is, if things are going to get worse, it may end up getting delayed. Like I almost want to get it out of the way if we're going to have an even worse fall.
Right. The CDC is predicting one of the worst falls in American history from the standpoint of public health. So if anything, maybe you can make that appointment earlier, like maybe bump it up a week if that's even possible. But who knows? It's probably all booked at this point.
Yeah, I'm gonna make a phone call and demand that I be taken care of course. Okay, the island nation of, I don't know if in English it's pronounced Anguilla, Anguilla, I don't know, but Anguilla announced that on August 13th, or announced on August 13th, that it was entering phase 1 of its reopening and would start accepting applications in a few days for entry from people who want to travel to the island. And tourists, depending on where you're coming from, will be allowed to return after November 1st, maybe, unless things get really bad again and they end up having to go backwards. And their statement is that they are currently COVID-free, so the objective is to reopen prudently, take every precaution, so on and so forth. Now, with all of these small island nations that have started reopening, Aruba, there's quite a bunch of them. They say we are COVID-free. And of course, that's true at the time because they have so few people and travel has been shut down. Sometimes they've had a handful of deaths and that's it. That doesn't mean that when you reopen, cases aren't going to come in. And so I don't know. It's like, I understand the desire to go somewhere and just sit on a beach. And it's like, hey, they have no cases. I'll just fly in. I'll take a test. If I'm negative, I'll just hang out on the beach. It's worth it. Then I'll come back. The risk is low. But if a whole bunch of people start doing that, at some point, someone's bound to catch it and start showing symptoms while on the plane just after getting their negative test. Like it seems that mathematically it's a complicated proposition.
Yeah, I think islands are giving a false sense of security, right? Because they're sectored off from the rest of the world. And in some cases, they are doing well with the virus. Like maybe Anguilla really doesn't have any cases right now. But that doesn't mean that that's going to hold up. We saw in New Zealand, they were doing super well, didn't even have any cases in the entire country. Now they do have some. And that was despite what they were doing, which was quarantining people before they were able to enter the country. And even with all those precautions, the testing, everything that they're doing, you still can't prevent it because it's such a contagious disease. And, you can incubate it for a few days before you show up positive on your test. So like, you can't keep it away forever, it seems. You have to sort of do harm mitigation. And so that's why I wonder, like, if this island nation is saying, everyone, you guys can come in if you follow the right protocols and we find it worthwhile. it seems just very risky, right? Like there's going to be a disaster situation maybe coming up soon.
The other risk with a lot of these places is, listen, I've been to Aruba. I think it's fantastic. The beaches are awesome. The people are just great. I loved it. I have friends who have been in Aruba. They were there for a family vacation, and their dad, who's, roughly like our parents' age, who has diabetes, had a complication related to diabetes and ended up in an Aruban hospital. It wasn't the best experience. And the number of facilities that we would consider sort of, reliable are somewhat limited. And on a lot of these island nations, the medical system can get overwhelmed far faster than it would. And you can't just drive 45 minutes to be in a totally different area with a whole different slate of hospitals. That's the concern for me.
Yeah, and can you even go back home? Are they going to let you back into the country if you actively have coronavirus? Like, what would that even look like if you're trying to get back into the United States? I'm sure they have to let you in, but like, do they send you right to the hospital? Do they send you right into quarantine? That must be a disaster too.
Does the airline allow you on if they're doing temperature checks and you have coronavirus? I mean, it's very complicated.
You shouldn't go on that airplane, right?
You shouldn't. It's very complicated, and so it sounds like this isn't appealing to you, Pat.
No, I think I'm going to stay put for a little bit. I don't even have the ability, it seems, to travel to many other places. Maybe this would be one of them, but I'm just going to stay here, I think. Enjoy my high-speed internet connection.
There you go. It's the internet is working beautifully these days, and I think at least for that we can be grateful. That's going to do it today. I hope you will join me nightly this week for the Democratic National Convention starting at 8:45 p.m. Eastern Time. I will be with you. We are looking into a different phone system for callers we're doing two things. We finally convinced the people that run the phone system that we have a problem which they need to fix with the crackling noise. Simultaneously, we are developing a parallel phone system, which hopefully we'll be ready to switch to if necessary. So more news on that upcoming, but certainly possibly good news as far as the phone calls go. We'll be back with you tomorrow with a new show and a new bonus show.
The David Pakman Show at davidpakman.com.